What are the secrets to COMLEX Level 3 question design? Imagine sitting in front of a test that not only checks what you know but also how you think on your feet. That's what the COMLEX Level 3 exam is all about. It's designed to see if you're ready to practice independently as an osteopathic physician. The questions are carefully crafted to do more than test memorization. They focus on real-world clinical decision-making, which is key for your future practice. The exam includes two main types of questions: multiple choice questions and clinical decision-making cases. You'll face 420 questions in total, with 26 cases that simulate actual patient scenarios. These cases have two for questions each, asking you to interpret data, decide on tests, or plan treatments. The goal is to see if you can apply your knowledge in situations that mimic what you'll encounter in real life. The questions also highlight osteopathic principles, like treating the whole person, not just symptoms. You'll see scenarios that include structural exam findings and lifestyle factors that influence health. This makes the questions more realistic and relevant to osteopathic practice. The exam covers core clinical disciplines, from internal medicine to surgery, ensuring you're well-rounded. The questions are designed to test different levels of thinking, from simple recall to complex reasoning. Some questions even include audio or visual elements, like images of structural findings or sound clips, to make the scenarios more lifelike. Every question is written by experienced osteopathic doctors and reviewed multiple times to make sure it's fair, accurate, and aligned with what you need to know. The question bank is constantly updated to stay current with medical advances. To prepare, focus on understanding osteopathic principles and how they connect to clinical practice. Practice clinical scenarios that requiring you to interpret data, make diagnoses, and decide on management plans. Use question banks that include case-based questions similar to the exam. Practice timed sessions to get used to answering questions efficiently. Remember, the goal is to be comfortable with both the content and the format. Knowing how questions are designed can help you develop strategies to approach them confidently. Focus on applying your knowledge, not just memorizing facts. The exam is structured to challenge your clinical reasoning and decision-making skills, so practicing those areas is key. Keep in mind that understanding the question design will help you identify what the exam really tests: your ability to think like a practicing osteopathic doctor. So, when you study, simulate the exam environment, work through case scenarios, and get comfortable with the types of questions you'll see. That way, you'll be ready to face the COMLEX Level 3 with confidence.